Hi everyone, this is my presentation on the effects of stress on neuroblastoma. So neuroblastoma is one of the most common forms of pediatric cancer. It actually accounts for 7 to 10% of all pediatric cancers and is the most commonly one diagnosed before the age of 1. So it's definitely targeting a young and vulnerable population, but hopefully with more research coming out that we will be able to find better treatment and be able to help these kiddos out. So, neuroblastoma is a cancer of the sympathetic nervous system that develops from nerve cells called neuroblasts that don't form quite right. And they're most commonly found on the adrenal medulla and paraspinal ganglia. Maternal stress was one of the key studies that I found throughout my research. I think this is very interesting because since neuroblastoma targets such a young population, these kiddos haven't experienced much psychological and physiological stress quite yet in their lives directly, but I think that looking at their time spent in utero may give us a little bit of a hint into what they've gone through yet. So, hypoxia and glucocorticoids were two things that were found elevated in a fetus when the mother is stressed, and these also happen to promote dedifferentiation in neuroblast cells. So these researchers took a group of pregnant mice. They were called THMYCN mice, which are models of mice that present preclinical forms of neuroblastoma, and so they're very commonly used in research for this type of cancer. So these pregnant mice were subjected to stress, whether that was cold temperatures or just unpredicted stimuli, and it was found that their offspring had increased mortality, malignancy, and growth of tumors. So they also found that there were no advanced lung metastases or disease-related deaths in the control offspring. So this study really pointed towards stress potentially being an environmental factor in modifying neuroblast deformation. Similar to that study, the same group of researchers very recently came out with a study about paternal preconception stress. And they also used the THMYCN males, and they subjected them to chronic unpredicted stress for 6 weeks prior to mating. And they found that their offspring as well had decreased success rate of pregnancy, increased tumor development and frequency, as well as leaning more towards a metastatic phenotype, which is the cancer spreading to more places than just the original spot that it was in. And so paternal stress may also impact neuroblastoma progression. And this group of researchers really pleaded for more research to be done on prevention and potentially identifying biomarkers that can show us what may be a common theme in neuroblastoma. So after looking at the stress of mom and dad, I wanted to look into children's experience in a traumatic medical situation. So this study actually interviewed pediatric patients that were just transferred out of the pediatric intensive care unit and asked them about their experience with doctors, nurses, and just in the hospital in general. So 95% of patients used sleeping as the most common effective coping mechanism. And I think that that is interesting because it shows that when there's a lack of control, sleeping is definitely something that we can do to assert control. I think it's important to recognize that medications that they're on and also just fatigue from battling illnesses is very exhausting and can cause them to sleep a lot more. But I also think that sleeping is a way for them to turn their brains off and to stop worrying or being scared about what's going on around them. And so that was a very commonly used method of coping. 86% of patients also liked talking to somebody. The kiddos didn't want to be by themselves. They wanted a nurse or a family member in the room with them to talk with them and to feel like they had someone. As well as behavioral distractions, which could include games, crafts, watching TV, listening to music, all those types of things that kids like to do. So, as many of us have found, I'm sure, cognitive behavior therapy was one of the effective methods in stress management for pediatric oncology patients. Cognitive behavior therapy aims to acknowledge, counteract, and manage thoughts to help people flourish. And while this may look different for a child than an adult, it was still found to be effective. Children need things to be more at their level to understand versus talking about something as complex as fears and anxiety and medical treatment that they're going through. So, therapists use cognitive restructuring, relaxation techniques, visual imagery, and skills training to accomplish this. And I found a study that showed that oncology patients noticed better control of fatigue and increased quality of life thanks to cognitive behavior therapy. Another resource that could be effective for children in the oncology floor are child life specialists. And of course, I had to throw this plug in there because this is exactly what I'm studying to be. And I cannot wait for the potential to hopefully help manage the stress of kiddos that are going through a crazy time in the hospital. So, child life specialists, as you can see in these pictures, use medical play therapy to normalize hospitalization, preparation for medical procedures, educate with developmentally appropriate objects, and establish therapeutic relationships with parents and families. So they like to use dolls and stuffed animals and things that are more understandable for a child to normalize those scary things like getting shots, an IV, losing their hair, getting their port accessed, having surgery. They'll give the kiddos a more hands on experience to put those tools in their hands, say, here you go, it's not that scary, you can play with it. And so these people are super beneficial to helping relieve the stress of kiddos who are in the hospital, and it's something that they don't really understand that well. I also thought it was important to note that there should be stress management techniques for pregnant women, as we saw that stress in utero really has an impact on the fetus's health. So I looked at a 12-week intervention that had relaxation guided imagery for pregnant women, and participants reported that they had improved breathing, ability to become calm, channeling and decreasing stress, and the ability to fall and stay asleep. So, being able to focus on the positives and be able to relax better and helping pregnant women would be really helpful because their mental health directly affects how the fetus is developing. And I wanted to end my slideshow with this cute little picture of Tommy. She is a 5-year-old who is battling neuroblastoma right now, and her mom are very public and open about her journey and what she's gone through during treatment. And I think it's just really important to note that children are super strong and resilient, and with measures taken to help reduce their stress even more, there's even potential for better outcomes for them. Neuroblastoma has pretty good 5-year survival rates, but with reducing their stress and more research, hopefully we'll be able to get better treatment and better outcomes for cute kids like Tommy. So thanks for listening to my slideshow and hope you guys have a great day.